Good afternoon. It's nice to see you all. Before I get into more details on this site that we're here today to visit, I want to give a quick update on testing generally. As we've said before, expanding testing capacity in the Commonwealth is a major part of our multi-pronged approach to pushing back against the spread of the virus. Testing, I think, as most people know, is important because it helps us determine not only who's infected, but where in particular around the Commonwealth we may have hotspots that we need to focus on. And by figuring out who's infected, we can obviously make sure those people isolate themselves so that they don't spread the virus to anyone else, and that we can then communicate with the people they've been in close contact with in recent days so that they can isolate themselves as well. It also helps our public health workers to do that contact tracing, which is when we figure out all the close contacts of the infected person, get in touch with the contacts, and provide them with the advice they need and ask them to isolate. On Friday, we announced a new initiative between our administration and the nonprofit Partners in Health that will eventually deploy almost 1,000 people who will serve as virtual contact tracers and will do the important work of reaching out to all the close contacts of people who are deemed to have been tested positive. The effort will build on work that's already been done by the Department of Public Health and many of our local boards of health, which has been going on every day. The big issue on this one is dramatically expanding capacity. When you start talking about 1,000 people and you start plowing into that, many of the assumptions that our team has made at the command center with respect to surge and possible cases, we simply need a much bigger platform to be able to deal with contact tracing on a go-forward basis. Another strategy that obviously we've talked about a lot over the last couple days is expanding our medical capacity to treat those who are infected. To that end, we've been working to increase hospital bed capacity, secure key medical supplies like ventilators from the federal government, and increase the supply of personal protective equipment to support our frontline workers as they battle against the virus. And while I'm standing here today in the shadow of Gillette Stadium, I'd be remiss if I didn't take this opportunity to once again say thank you to the Kraft family and the Patriots organization and all of those who worked with us to get the shipment of 1 million masks in from China earlier this week. Now, with respect to testing results, most recently, as of yesterday, we've tested 68,800 individuals. There were over 5,800 tests that were done yesterday. Significant progress on expanding our Commonwealth's testing capacity across Massachusetts. We've said previously that we wanted to test at least 3,500 people a day, and we've been conceding that goal consistently now for almost 2 weeks. We're going to continue to pursue new ways to increase our capacity, and that will include sites like this one here in Foxborough. This site will perform, just opened up this morning, it will perform up to 200 tests per day, perhaps more depending upon available materials and kits for police officers, firefighters, and other personnel who perform critical public safety functions and are experiencing one or more designated symptoms. Testing is performed by appointment only, and eligible workers looking to get tested should contact their supervisors for more information. Detailed information was sent out by the Executive Office of Public Safety and Security on Friday on how to secure an appointment to these public safety departments so that they would know how to follow through on behalf of the members of their team. The drive-through testing site will operate 7 days a week and provide tests within 24 to 48 hours. It's a partnership between our administration's Executive Office of Public Safety and Security, the New England Patriots, the Department of Correction, who's actually put together and made a lot of the gear that's being used, WellPath, and Quest Diagnostics. And the tests are being provided free of charge to first responders. While the effects of this public health emergency are obviously keenly felt by all of us, some of the greatest challenges associated with meeting it head-on are being met by our men and women in public safety. And these professionals are working in high-risk environments to protect our communities, and we felt it was important to continue to expand our capacity to support them. We've put a number of orders in place to try to limit the number of people that are outside their homes right now, including limiting those who are still working non-remotely to just performing essential services. We're working to get more PPE to our first responders because their jobs, for the most part, still require them to be out and about in their communities. And we know that sometimes we're not able to maintain the same social distancing guidelines that we're all trying to follow because they're responding to an emergency situation where it's simply not feasible, and by doing so are putting themselves at risk in responding to the call that they've been asked to do. We're grateful for the countless hours of the Commonwealth's frontline workers and first responders and all that they're doing to put themselves into this fight against the virus. This testing site and others that will be opening soon will be a good resource to ensure that they have the medical attention that they need if they believe they're infected with COVID-19. I want to thank everybody who's been associated with this. This is literally a local, state, federal, public-private partnership that's been involved in setting this up, including the healthcare workers behind us that are running this site today. And with that, I want to turn the podium over to Lieutenant Governor Karen Polito.
Thank you. Good afternoon. Thank you, Governor. I wish to just start by thanking the team of people came together to build up this site and this critical piece to help us combat COVID-19 here in the Commonwealth. We stand literally at Gillette in Lot 50 for a very different use from what this parking lot was created for. I just want to start by thanking the Kraft family for once again stepping up to help us in this fight. I also want to thank, as the Governor did, our team at EOPS, Public Safety, marshaling all their resources and working as effectively as possible with our federal and state partners to see this set up here. So why is this important? When you think about our emergency responders, our police officers, our firefighters, the individuals providing emergency medical services, driving ambulances and getting people from one place to another. I mean, we think and we know of these people as our heroes, but they're human. And in order for them to do their jobs, a couple of things that are really important. First of all, that they have the gear, and we've talked a lot about that, to be able to get into their jobs and do their work for us. But this piece is also really important for them to know their status. And so a testing site like this allows for police officers, firefighters, emergency responders to be able to get tested if they feel symptomatic. And that test will allow them to understand what their status is so that then they can take the next step to protect themselves and recover, and also to protect their families at home. The one thing the Governor and I have heard so much from these individuals about is not so much about themselves, but about their family members at home, that they worry they're going to put them into harm's way. So this test is really important for that purpose. It's also critically important because these individuals are putting themselves into situations where they're coming in contact with potential positive patients. And these patients need to know as well if there's a person that's affected that they're coming into contact with. So not only to protect the first responders, to protect their families, but also to protect patients that we are trying to serve all across our Commonwealth. This is a great advancement today to see this site become available. And at home, you can continue to do your part by making good decisions every single day about the kinds of activities that are necessary outside of your home to engage in, and to also do your part to be informed. There are multiple places that you can get your information, in addition to the daily press events that the Governor and our team hold. But also, if you need to identify an answer to a question, you can engage in dialing 211. You can get up-to-date announcements from our administration by texting COVID-MA to 888-777. So thank you to everyone for making this possible today. And I'll now turn it back over to the Governor.
Questions?
Governor, there's a bill, actually a couple of bills for first responders that if they track coronavirus, they'd be considered in the line of duty. Is that, and that they would be able to be paid while they're recovering and would go against their sick time. Is that something you support?
You know, I tend not, as an administration, to speak to pending legislation because you never know what it's going to look like when it comes out the other end of the process. But that is something that we've talked with folks in the legislature about. Like everything, it's going to depend on the details.
Do you support the concept, though.
I think the concept's a reasonable concept, yeah.
On the topic of resources, the Vice President was talking about state houses working with the federal government. Where are we as far as the state of Massachusetts, ventilators, resources that you guys want to get to the base?
We actually got a shipment last night, which was unpacked this morning of ventilators from the national stockpile. There were 100 of them. The process for distributing them was developed by the medical advisory group that the command center put together a couple of weeks ago, and those will be distributed based on the work that was done by that group, which included, by the way, both teaching hospitals and community hospitals, and my guess is they'll be distributed over the course of the next 24 hours.
Earlier last week, you said that we're going to get 1,000. We're expecting 1,000. Are you getting 100 instead of the 1,000?
We believe that the process as it's been laid out to us is going to be an incremental one. We don't believe this is the last shipment. We fully expect that we'll get additional ventilators over the course of the next 2 weeks.
But you were expecting 1,000 at the end of this week, the beginning of next week.
That's correct, yep.
How long will the site be up and running, and how many more of these sites do we really need in order to test out the field necessary?
I think it's going to run as long as it needs to. One of the things about dealing with an unprecedented outbreak like this is it's very hard to draw big conclusions about exactly how it's going to work and how long it's going to last. Our view on this is that, as the Lieutenant Governor said, you're going to have first responders putting themselves in difficult and complicated situations for a while, and obviously we're going to run this site as long as it takes to make sure that we can continue to ensure that they get tested and tested promptly. We've been having conversations with our colleagues in Western Mass and our colleagues in the Merrimack Valley, and I think you can expect to see additional sites open up in those parts of Massachusetts sometime later this coming week.
Governor, you talked about the surge. Are you encouraged by another field hospital, PCEC, going up today in case those numbers do surge in the month of April?
So there are a number of sites that are under discussion or under development with respect to additional hospital field capacity, and one of those obviously is the one the Lieutenant Governor and I toured at the DCU Center in Worcester last week. There's another one that's being developed as we speak at the BCEC for what I would describe as Greater Boston, but there's also one that's going up on the Cape at Joint Base Cape Cod that is being led by the folks at Mike Lau and the folks at Cape Cod Hospital, and there's also a conversation going on about potentially doing one in Western Mass as well. Those are in combination with some of the sites that have been developed both on the acute hospital side, where certain facilities are either making floors or entire facilities, COVID-19 specialty facilities or specialty sites, as well as some of the skilled nursing facility capacity that is being put up as well. But the goal here obviously is to be able, when people are ready to move from an acute level of care, because they no longer need to be there, but they still need to be watched over and cared for, to be able to move them to a lower level site with a significant amount of sort of clinical capability and equipment to serve them, so that the hospital, the acute facility, can continue to serve additional people who not only are COVID-19 folks, but also are other folks who are dealing with the many other issues that our hospitals deal with in Massachusetts every day. In the end, you're probably talking about somewhere between 1,500 and 2,000 additional beds.
Governor, the way, this piecemeal way that stuff's coming in from the national side, does that make it more difficult for the plant? You planning for 1,000, only getting 100, now you have to start from scratch again and figure out what you do. Are we ready for the surge?
Again, when you're dealing with an unprecedented circumstance, you do a lot of modeling, and as I've said many times, all of our modeling is based on what we know as of today, okay? And our anticipated assumption here is that sometime around April 10th, we expect we're going to head into the peak of the surge, and that sometime around April 20th, we should reach the sort of top of the apex and then start coming down on the other side. But those numbers could be off by a few days. We were talking at one point that it was somewhere between the 7th and the 17th. Some people have talked between the 5th and the 15th. There's some discussion about whether or not a lot of the social distancing, stay-at-home advisories, essential work orders that we've issued have actually flattened the curve a little and pushed it out. So my answer to your question is we are planning for a variety of scenarios. And obviously you'd love to have every single piece of gear you need as you head into it, but we're going to make adjustments as we go. And we talk to our colleagues in the healthcare community and in the first responder community practically every day. And the reason we talk to them every day is because we know we're going to have to be fairly nimble about the way we play this out based on a number of unknowns that you simply can't predict. I will say this, as we stand here at Gillette, the availability of 1 million masks through that initiative that we pursued with the Kraft Group is a tremendous asset in terms of taking that issue and that question about available N95 masks sort of off the table, and at least for the short term. The fact that we also have this joint initiative with Partners Healthcare and the Mass Hospital Association around this decontamination machine, which will probably start operating sometime this week and has the ability to decontaminate N95 masks and has been approved by the FDA somewhere between 5 and 10 times, is a game changer with respect to our ability to be pretty sure about the availability of that type of equipment over the course of the surge. But a lot of this other stuff, we're just going to have to manage as we head into it and make adjustments as we go.
What do you say to those healthcare professionals who are going to try to staff those DCU? They're coming basically to help out. What are your message to them?
Well, I said last week that when the Lieutenant Governor and I met the Kraft plane at Logan Airport, I said that, you know, the word that meant the most to us was gratitude. You know, some people called it a celebration. My view was this was a chance for us to say thank you to people who are putting themselves in very difficult circumstances and situations every single day. And, you know, I talked to Eric, you and I talked to Eric Dixon about this, who's the CEO at UMass Memorial. He has 500 volunteers who have signed up to help them run and operate that DCU center. And he's got people coming out of UMass Medical School, he's got people coming out of nursing programs, he's got retired folks coming back. Mike Lau said the same thing about the work they're doing down on the Cape to staff up for their operation. You know, we are in Massachusetts blessed because we are a sort of world leader when it comes to healthcare generally, and as a result, we have lots and lots of people who are very mission driven, who are responding to a call in this particular circumstance and situation and want to be there for their neighbors and their friends and their colleagues, and we're going to do all we can to make sure they have the gear they need. But, you know, our message is going to be all about gratitude. Gratitude for the people who are working here at this site, who put this up in 4 days, you know, and this was the National Guard, the hazmat folks, the state police, the Foxborough Fire Service, the folks from WellPath, the folks from the Department of Corrections who did most of a lot of the gear that's being used over there. I mean, there's a lot of people putting a lot of effort into making sure that we're as prepared as we can be. And yeah, our word on this one is thank you, and God bless, especially on Palm Sunday.
Governor, with that being said, do you feel comfortable if we have all the ventilators and everything available, that we'll have enough staffing to be able to manage those as well once this surge happens?
We're working the staff piece with the medical society and a lot of the folks in the health care community pretty much every day, and there are three big issues around this. One is where these folks live, okay? Because you want to try and match them with a place that's fairly close to where they are. And the second is what is their skill set? What was their credential? And are there things we need to be doing to make sure that that their credential will fit into the operating models that are being used on this extra capacity that's being developed? And then the third is how much time are people able to devote to it, and how do we build that so that we have the capacity working with our colleagues in the healthcare world to do this on a 24/7 basis, which is basically what you need to be able to do to support the folks that are going to be served.
Last question.
Governor, the New York Times are quoting French officials saying they had masks bought out from under them by a high bidder, Tarmac, China. Are those the masks we've got?
I don't believe so. Obviously I can't speak to the specifics of that. What I can tell you is that we believe, based on the conversations that we had, that when I first reached out to the Kraft family to find out if they would be able to help us figure out how to get the gear from China to the U.S., we already had, that was almost 2 weeks ago, we already had a secured purchase in place. So I don't think that's us. Thanks very much, everybody.
Do you agree, one last thing, do you agree with the CDC guidance about face masks?
So as I understand the CDC's new guidance, it's basically if you are outside and if you are going to be outside in a way where you don't have the ability to engage in the kind of social distancing that we and others have been messaging for a while now, then they do recommend wearing a mask to basically ensure that you don't infect somebody else. I mean, that's the primary purpose of it. I think that's perfectly appropriate guidance. We're going to do everything we can to make sure we continue to engage in the social distancing, because I said before that, the social distancing, the hand washing, the hand sanitizing, wiping surfaces off, doorknobs. I mean, these are in many respects one of the primary carriers of this thing, and people need to understand that. One of the things they have said about masks is it keeps your hands away from your mouth, which is also a good thing. But I think the CDC's guidance, which is if you're going to be in a place where you don't believe you have the ability to do the other recommended issues associated with distancing and hygiene, that you should consider wearing a mask to protect you and others. I think that's perfectly reasonable guidance, yeah. Thank you.